will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you can click the Raise Your Hand button. When you are called upon, we will unmute your microphone, and then you also will have to unmute your microphone.
Good afternoon, Hoosiers. Thank you for joining us, hopefully again, for our weekly updates. By the way, before we get too far into it, we will be back at 2:30 next Wednesday. I know it's Veterans Day, and so many of us will be celebrating those who have worn the uniform and all they've meant to us and our way of life. But we will be consistent, and we'll be back at 2:30 on Wednesday next week. Also, I wanted to address just at the outset, if I could, Dr. Box, and then maybe you could follow up on the effects of some of these rumors. But I've noticed over the last, say, 10, 15 days, there's been a number of rumors floating out there. Obviously, our Department of Homeland Security, Steve Cox, tracks these things because we don't want Hoosiers to be misled or receive disinformation and then make decisions based on that. We've seen some language out there that talks about how today we're going to announce that we're shutting the state down. False, 100%. No truth to that whatsoever. We also saw some information that said that our schools were going to go 100% virtual. As of today, again, false, 100% not true. And I would just ask folks to keep in mind in the future that wherever those sources are, to discount them because they're simply misleading people. And the unfortunate thing is it's affecting people's daily lives and the decisions that they make. And so not helpful, counterproductive, and we'll address those as they come forward when we see those things making their way into the public conversation. Also, what's not a rumor is our cases are going up. And we talk about how, as that positivity rate increases, what happens downstream. And hospitalization rates go up. Unfortunately, we see more deaths follow. And so we've taken, a very kind of localized, personalized, surgical approach to addressing these surges, no matter where they are in the state of Indiana. And that means that our resources, our personnel are working with our local health districts and local health offices. Our Department of Health again, Homeland Security, out working with local communities to make sure that we're not just talking about the importance of this, but also helping educate and helping locals with ways to enforce that will bring those positive case numbers down. Obviously, we're not alone in this, not, in the world, but also there's only the map that you showed me, only a handful of states aren't experiencing this positivity caseload increasing. And obviously this is hitting the heart of the heartland, the Midwest, all of we think about the Big Ten schools, but you think about those states and those positivity rates. And so this just means we have to continue to make sure that we're protecting lives first and foremost. And in doing so, we maintain the ability to protect our surge capacity. And obviously that can fluctuate from district to district, and we have to make sure that we're paying attention to what's happening, again, locally, county by county by county, and that's why we've sent Indiana National Guard personnel out. They've got 900 to go, but 400 out there in the field right now, I think, in the 534. Ultimately, they'll all be assisting, and that's going well. We're going to hear from, obviously, Dr. Box here in just a minute, and then we'll hear from Dr. Weaver, but we also have General Lyles available, and we have Dr. Dan also available. And with that, I will turn it over to you.
Thanks, Governor. Congratulations, sir.
Thank you.
Good afternoon, Hoosiers. As you know, we've seen a significant increase in the number of cases reported over the last couple of weeks. Our 7-day positivity rate is currently 8.7%, which reflects the recent increase in our cases. Between September 15th and October 25th, we saw a more than 200% increase in our number of cases. Our hospital admissions have also increased significantly and are at their highest level since the start of this pandemic. As of today, a total of 1,897 Hoosiers are hospitalized with confirmed COVID or suspected COVID while awaiting a test result. The number of daily admissions of people with COVID or those who have COVID-like symptoms topped 200 in a single day recently, and we're hearing from our hospitals about the strain this is placing on them. While we monitor our bed and ventilator resources 24/7, perhaps the greatest strain right now is in our hospital workforce, which is in the 9th month now of responding to this pandemic and facing the greatest patient load yet. They are frankly exhausted. They're quarantined or in a family quarantine. They're juggling home issues just like the rest of us, like hybrid schooling. And some have even lost coworkers and family members to this disease. This all takes an incredible toll. We're having regular meetings with our hospital systems in northern, central, and southern Indiana to assess their needs and discuss surge planning. The Indiana Hospital Association has been an incredible partner in facilitating these calls. We're talking about increasing hospital admissions, the availability of ICU beds and ventilators, and their staffing concerns. What we hear consistently is that their biggest challenge is having enough staffing. Some hospitals have already needed to rearrange their elective surgical procedures to accommodate their staffing needs. We also are receiving 3 to 5 requests a day for staffing assistance to our healthcare workforce reserved for hospitals. Unlike last spring, when the requests came primarily from long-term care facilities, we are now seeing hospitals make these requests. We continue to work with Bowen Center to deploy the recruitment survey to all licensed healthcare providers to ask for additional reservists who would be willing to serve in this latest surge. Quite frankly, our frontline healthcare workers are exhausted. They need our support now more than ever, both emotionally and physically. We're also seeing an increase in deaths, unfortunately. In October, 701 people died of COVID-19 in Indiana. 551 of those individuals were people of the age 70 or older. But we also saw 21 deaths in individuals under the age of 50, and almost all of those occurred in the last 2 weeks of the month. This is a stark reminder that COVID doesn't respect age limits and that we all need to take precautions to protect ourselves and the people that we care about. As we said last week, we have deployed the Indiana National Guard to assist with our long-term care facilities, which are also seeing increased cases. This first group was trained last week and began helping in facilities this week. Another cohort is being trained this week. The plan is for the Guard to be in all 534 facilities by the end of this month. We're sending the Guard first to facilities experiencing an outbreak. As you'll recall, one case constitutes an outbreak. However, we know that some facilities are being more severely impacted by COVID cases right now, and that situation changes daily. We have prioritized accordingly, but recognize that circumstances can change quickly in these congregate living settings. We're staying nimble and able to redirect resources if the need arises. Again, I want to encourage anyone who might be interested in joining the Healthcare Workforce Reserve to reach out, especially if you're willing to work in our long-term care facilities. I mentioned earlier that our hospitals are experiencing staff shortages and burnout and need relief, while our long-term care facilities are in a similar situation. I've heard reports about longer waits to get testing appointments in some areas of our state. This isn't surprising because as cases rise and more people have symptoms, the demand for testing also increases. What I do want to highlight is that we now have 75 sites being run by our local health departments that are offering community testing. That's 6 more than last week. We also continue to offer 4 state-run drive-through sites each week and offer almost 36 sites run by OptumServe. This testing capacity is essential, especially when we look at our color-coded map. The good news is that Dearborn and Ohio counties, which have been in red for 2 weeks, are now in orange. Unfortunately, we do have 3 other counties that are in red this week. Those are Fayette, Du Bois, and Fountain. This is the second week that Fayette has been in red. I reached out personally to the local health officers in Fayette, and we've reached out to the other health officers through our state epidemiologist, Pan Pontonis. We've discussed the transmission in these counties and the recommendations that we've outlined that could be helpful in decreasing these numbers of cases. We've also contacted more than 70 counties that are in orange to discuss their situations and review the color-coded recommendations with them. As a reminder, blue means minimal transmission is occurring. Yellow indicates moderate community spread and emphasizes considering restricting the size of gatherings and evaluating where cases are occurring. Orange indicates medium to high community spread. In orange counties, we reach out and discuss actions that we think should be included. Restricting the size of gatherings, evaluating the source of positive tests, and undertaking targeted testing, quarantine, and isolation is critical. Restricting attendance at school activities and sports events is also important. And red indicates very high positivity and community spread. The state can take action if a county stays in red for more than 14 days, with steps that could include restricting the size of gatherings and events, limiting capacity in businesses, limiting visitation in congregate care settings, and restricting attendance at K through 12 events. I want to stress how important it is to follow these recommendations. We've also reminded our local health departments that the state can provide assistance if local health departments have implemented restrictions but need someone to check to see if those restrictions are being followed. Soon I'm going to turn things over to Dr. Weaver for updates about the COVID-19 vaccine. But before I do that, I want to emphasize this. There are a lot of things we don't know or we're not certain about. We don't know for certain when we'll receive our first vaccine or when we'll have enough vaccine to immunize every Hoosier who wants the COVID vaccine. We also have rigorous review process in place where the state will look at the vaccine before it's deployed for use. We also don't know how effective these different vaccines will be and how much protection they will provide. We don't know how many Hoosiers will want these initial vaccines. But what we do 100% know, based on multiple lines of evidence and support, is that social distancing, wearing your mask, and careful hand hygiene decreases the spread of the virus that causes COVID-19. These mitigation measures, which we continue to emphasize, are effective and inexpensive. These are interventions that allow us to keep our businesses, our schools, and other aspects of our society open, while at the same time ensuring that our healthcare systems can continue to take optimal care of every Hoosier, regardless of their medical needs. So please, don't let your guard down. Be vigilant so that we can get through this pandemic. Thank you.
And now we'll turn it over directly to Dr. Weaver for an update as well. Dr. Weaver?
Yes, thank you both. So, as we've said previously, we have been told by the federal government to be prepared to receive initial shipments of COVID-19 vaccine as early as mid-November. We don't know yet whether that timeline will hold, and what we can assure Hoosiers is that we will be ready to receive it. The federal government has asked every state to identify 1 to 5 sites to serve as pilots for the initial distribution of the vaccine. These facilities need to have ultra-low storage for the vaccine and also the ability to vaccinate not only their frontline staff, but also the staff of some surrounding hospitals, long-term care facilities, and other healthcare workers, depending on the amount of vaccine that we receive. No vaccine will be administered, however, until we have the CDC's Advisory Committee on Immunization Practices recommendations and our own public-private team has completed its evaluation. I want to emphasize that we have assembled a team to review all research related to the vaccine so that we can ensure that it is safe for Hoosiers and administered to the population in which it was studied. This is important because this is a new vaccine that will be approved under an emergency use authorization. That process has involved collaboration with several entities, including the Indiana Hospital Association, to ensure a diverse representation from across the state. It included infectious disease doctors, infection preventionists, pharmacists, pediatricians, outpatient primary care, including federally qualified clinics, health departments and health department officers, ethicists, long-term care associations and facility representation, an OBGYN, disabilities representative, a minority representation, FSSA, lawyers, quality directors, hospital administrators from both critical access hospitals and large urban systems, vaccination experts, physician licensing agency, Regenstrief, the Indiana Health Information Exchange, medical education providers, state medical associations, safety coalitions, the Fairbanks School of Public Health, and logistics experts. And others who I did not include there who raised their hand to assist in this critical component of vaccine allocation and safety. In all, it included 26 entities and 44 participants and is growing, including even today. The group had met 1 to 2 times a week for 4 weeks to assist with developing Indiana's vaccine allocation and distribution template. Several members of the committee were relieved of their other duties to help focus solely on gathering and organizing the needed data and information the advisory group needed to make informed decisions. We will continue to meet with our advisory team to review all the information about the vaccines we receive, and we will not distribute them until the team has completed its review. This process will allow us to vaccinate with confidence and will be a significant step forward in protecting Hoosiers from COVID-19. We have surveyed every hospital system in the state for their ability to immunize not only their staff, but also additional healthcare providers in their area and to determine their access to ultra-low storage. We are working in collaboration with IHA to confirm that these sites will be able to store and administer this initial vaccine, which is complicated, not only by the fact that it's ultra-low storage requirements, but also the limited time between thawing and administration of a 2-dose vaccine that also needs to be reconstituted or mixed at the time of administration. We expect to have the 5 sites initially that represent all geographic regions of the state. This is just the initial pilot phase. Many other hospitals have expressed a willingness to participate, and as vaccine becomes more widely available for phase 1A and 1B, we will be engaging more partners. While we don't know exactly when we will receive the vaccine or how much we will receive, we do know that the first priority will be frontline healthcare workers who come into regular contact with COVID-19 patients. This includes hospital staff and those in long-term care facilities. Thank you.
Thank you, Lindsay. Now, Rachel, you want to just dive right in?
Eric Berman, WIBC.
Good afternoon. Congratulations, Governor.
Good afternoon. Thank you, Eric. How are you?
I'm good, thanks. I wanted to back up a couple of weeks to one of the gubernatorial debates when you were addressing the question of masks and said you, quote, looked forward to talking about that with the legislature. What specifically do you hope to do on that? Do you need legislative authorization for a mask mandate? Are you looking to put enforcement provisions to a mask mandate? What nature will those discussions take? And I'd like to follow up.
Yeah, and maybe I was a little awkward in my articulation of what I was referring to working with the legislature. No, I was referring to the authorization that I have under and obviously the Dr. Box while operating in a public health emergency. And so I look forward to addressing, and I've been in constant communication with the legislature, but when they do come back in January, being able to address any concern that they might have, not just the necessity for a mask mandate for the state, but for, any other question that they might have or access to information that they might want while they're all here. But it wasn't directed specifically at, looking for permission for a mask mandate.
Angelica Robinson.
I think he had.
I'm sorry.
Eric, did you say you had a follow-up?
I did, yes.
Okay.
If I'm still unmuted,
Gotcha.
Excellent. On a related point, obviously the big news yesterday is the election. You won by a large margin. Does that change your ability to deal with some of the folks in the legislature who have been vocal about their opposition to the state of emergency and masks and the other measures that you've taken?
I'd be a hypocrite if I said it did. It will not. The decisions that we make here have zero, zip, zilch, nothing, nada, I don't know how to say it any clearer, to do with politics or campaigns. This is the only campaign that we're running here is a campaign to try to save lives and get through this as, again, I think I said this the first time, as safely and swiftly as humanly possible. And these daily and weekly reminders about how far we still have to go, we're going to have to manage our way through this. It ultimately and most effectively can be addressed by the individual themselves. I think Dr. Box said it right when she said these are, I think I'm going to put a few words in your mouth, but you said relatively inexpensive and effective steps to take versus, by the way, the other side of that is versus the ultimate cost of not doing so. So very effective and a few steps that every governor I talk to on a weekly basis says, if we put this little inexpensive piece of cloth and prevent the airborne transmission of this virus, we will be able to collectively, for the common good, individual by individual, slow the spread. And that, like I said, has positive effects downstream in our hospitals, a cost associated with that, or a cost associated with our kids not being in the classroom. And so to just be cavalier and say, I don't make that much of a difference. Well, A, it does. B, we don't know enough about this when you're looking at the fatal impact it can have, not just on the elderly, but on those half their age. And so that's why we're going to continue to work hand in glove with our local partners all over the state of Indiana to manage our way through this. And oh, by the way, at the very same time, not take our eye off the ball, there's the lives and the livelihoods side of this ledger, and we're going to keep this economy not just going, but growing. Because that is more than hope. That is the opportunity that I did speak of over the last few weeks.
Angelica Robinson, Wayne TV.
Good afternoon, Angelica.
Good afternoon. How are you?
Very good, thank you. Little tired. No, just kidding.
I understand.
If you see bags under my eyes.
We've talked about the increase in COVID cases, and we've also seen a record number of voters heading to the polls. We've seen long lines. How concerned are you guys about another spike following, Election Day? And are there any actions that you feel need to be taken, to try to control that spread of COVID-19?
Feel free to follow up. But no, Angelica, we were watching this all over the state of Indiana. And I want to say thank you to all of, not just the folks who voted, regardless of what team you supported. Thank you for voting. Thank you for that expression. But also for the folks that were working those poll sites. Our Secretary of State making sure the resources were distributed long before they were going to be needed. And everyone that was on the ground making sure that they were safe to vote. It was safe to vote during the primary. it was safe to vote ultimately yesterday, but for the month leading up to it too. It was more like election month. And we proved that we could do it safely. I don't know of any cases yet that have been traced back, but from what we were picking up, and please do comment, people were masked up, people were spaced, there were, long lines, but 92 different counties were making decisions based on, could be a record turnout. Mm-hmm. And so it was, I think, we showed how it could be done. And what you heard from people who were turning out in person, their narrative was they wanted to vote in person. That was part of their civic duty, and that's the category I fell into. I voted in person, but it was nice to see that expression be able to occur even in the day we find ourselves in.
Yeah, I agree, Governor. My experience was it was an hour start to finish for me to go and vote in person yesterday. We were maybe not as socially distanced in the line outside in the fresh air, but everyone was masked. When I got inside, they absolutely made sure everyone was socially distanced. I noticed that they were cleansing every machine before the next person was allowed to come. They had plastic barriers up. They offered masks to anybody that needed one. I was really happy to see that some elderly people that had underlying health conditions that were on oxygen stuff were brought to the front of the line. And I was really happy to see that the average age of the workers at the polls had dropped quite a bit. Mm-hmm. And I even mentioned it to them and thanked them for working. And they said, that's by design, because they're at higher risk. And I said, I know. So the other thing is, I would say I'm a lot less worried about what happened at the polls and what's going to happen over Thanksgiving, to be honest with you.
Yeah. With
and
family members coming from all different directions. And yeah. And I think, again, kudos to everyone that had a role and a part in making sure we could offer a safe voting experience, again, for the month leading up to yesterday. That was my experience. We had a plan, and that was I was going to vote when it made the most sense, and we were looking at 27 days out, and it got to be about 4 or 5 days from Election Day, or maybe 4 days. And there, in the evening time, you could monitor that online, which, a little technology goes a long way. And I voted at the city-county building downtown, and I was in and out in 5 minutes. And so I know that wasn't the experience for everyone, but everyone could have had the same experience if you were in Marion County, if you were monitoring all your different options. So that's a challenge to the BMV to get in and out to the BMV or to vote during a record turnout year, potentially.
Dustin Grove, WTHR.
Dustin, good afternoon.
Good afternoon, Governor. I'm just curious to know if the numbers, COVID numbers, are similar to what they were in the spring. Talking cases, hospitalizations, highest they've been, increase in deaths. Why are we still in stage 5, and what will it take to have to go backward, take a step back?
Yeah, we're not, and I see you almost finished my sentence, or finished my first word. We're not in the same place as we were in the spring, and that has all to do with our capacity to care, not just surge capacity, but our capacity to care. So that's what we look at, and that's what you're working with local communities each and every day. And you might want to talk about when he's comparing now to then, apples to apples.
Right, and I think that's an excellent question, and I understand where you're coming from. That I would say that as we look at these cases, unfortunately, the Midwest, all of our neighboring states are having similar significant increases. In fact, the Midwest, I think everyone is over 60% increase in their positivity rate over the last 2 weeks, and a couple of the states that are even more shut down, meaning bars are not open, you can't go into a restaurant, and our bars are open, but the tables are socially distanced. Individuals have to be masked if they get up from the table. Individuals in restaurants have to be socially distanced. So it's not like we're open to the normal world pre-pandemic. So when I look at this, we have to choose those things that we know we're going to make an impact with. And that is convincing Hoosiers across our state that if we would wear our mask and socially distance and wash our hands, stay home when we're sick, get tested, and allow the contact tracers to work with us so that we can help to figure out who else may have been become infected, this is how we can decrease the spread. And as the governor said, we are working county by county, region by region, with hospitals, with local health departments, with our school systems, and actually making changes and tweaks at the local level to address this.
And I would just follow up, Dustin. I mean, there is a level of frustration that we want to make sure folks know that this works. It's one of the best tools we have, physically distancing, good hygiene. But as Dr. Box just mentioned, you have states that border us, and they have gathering limitations. As an example, Michigan is indoor, a limit of 10. Ohio is 10. Kentucky is 10. And yet they're experiencing some of the same things. So what the common denominator actually is, what's working where, county by county. And when you look at this map and you see, yes, you mentioned 3 red counties, one of which is a carryover, but they're different than they were last week. And so that's what I mentioned last Wednesday is we don't want folks to get religion after the fact. We want to be proactive to bring that number down. And that helps us and our economy be open.
Kathy from the Ferdinand News.
Good afternoon, Kathy.
Good afternoon and congratulations.
Now the real work begins. Second half, coming out of the locker room.
Unrelated questions totally. The first is economics. We know that things have been tight. How are things looking for the next year and even the year after economically for the state?
Yeah.
That's my question for you, and then have another one.
Okay. Well, that's a good reminder actually to have our OMB director, Chris Johnston, on next week so he can kind of give you an overview of how revenue is performing. Actually, we are more than holding our own as a state from the fiscal side of the house. We can set the physical side aside here for just a second, but the fiscal side is when you look at a lot of the indicators, and I don't want this to sound like I'm not compassionate to all the loss and all the heartache and all the pain that we've all endured. However, having said that, keeping our economy open, as an example, single-family home building permits this September are 33% over what they were last September. And when you look at our sales tax revenue, when you look at our income tax revenue, it is performing at or above, around, I should say, our projections, our forecasts. And so when you look at the number of people going back to work, take our hospitality sector, which when airplanes aren't in flight and big conventions aren't going on, that's understandable that that's still lagging. But when you look at the other indicators, home sales, et cetera, now the trick is to make sure that we get those 200,000 plus folks who are out of work from that 17.5% that was unemployed now down to 6.2%. We're tracking in the right direction. We were one of 5 states to send the most people back to the private sector as fast as we did. And that's a credit to our every small, medium, and large business out there in the state of Indiana figuring out a way. And again, I'll say this, thankfully, they've figured out ways to do that safely. And oftentimes, our private sector is most concerned about not when you're at work, it's when you're not at work. And that's what is keeping our economy going, and that's what's offering more opportunity. I'll just say this, because I don't want this to get too off course or filibuster, but last Friday, we're knocking on about 27,000 new jobs coming to the state of Indiana. through the IEDC at an average wage of over $27 an hour. And I just bring that up because in 2016, for a point of comparison, we just did over 20,000. So we've already done over 7,000 new job commitments coming to the state of Indiana during a global pandemic. That bodes well for us. But again, that means we got to skill people up to fill those jobs. And if a job was lost or you were displaced, we got to get you connected with that new opportunity.
Thank you. My other question is, okay, I'm in one of those 3 red counties, and we seem to have not been good all along. But I'm very concerned
She's in
because
Du Bois.
basketball is getting ready to begin. And we're such a basketball area in a basketball state. And I'm wondering what is being recommended to schools across the state as far as this indoor sport is concerned.
We're a football crazy state too, and Dr. Box has had a lot of conversations about everyone's child going pro.
So, Kathy, that's a really great question, and it is really hard because it is basketball season, and I know we are Hoosiers at heart. So I respect and understand that. I will say that, again, I don't believe that most of these cases occur on the football field while people are actively participating or on the basketball court. Where they occur is in the gym before the competition, after the competition, what kids and families and administration do before and after. That being said, our recommendations when you get into the orange and the red are that you severely limit the number of people that can come. Like we're talking probably mom and dad get to come, or potentially even having that opportunity to only have the athletes themselves and their coaches and referees there, those people that have to be there for the game. And that is not something that I want to have happen. But we have to take this seriously. And we know we lost lives in sectionals last year from this disease. And I don't want to see that happen. I don't want to see a spread where people are yelling and screaming. And Kathy, sometimes people in counties just don't believe in the mask wearing. And I really believe if we all would start to be very fastidious about wearing our masks, especially when we're inside, especially when we're in places where there's not good ventilation, there's not good recirculation of air, and socially distanced, that we can have these things go on across our state and enjoy them. And I think it's important.
And the good news is you're working directly with your whole team, as you mentioned, school corporations, mayors, county commissioners that are addressing this at the very local level, either before or after the fact, when we see these cases start to go up. So it does work.
Adam Wren, Indianapolis Monthly.
Afternoon, Adam.
Afternoon, Governor. In one of the gubernatorial debates, you sort of compared a mask mandate to, driving with the seatbelt. You've also spent some political capital in your first term on getting a hands-free driving law in place. Why not just put a penalty on the mask mandate to kind of square that metaphor? I mean, what is your thinking around that? Is it an issue of working with the General Assembly? Is it a philosophical issue? How do you see that?
No, I mean, more than anything, Adam, to me, it's an effectiveness. It doesn't, I don't think this works unless you have strong on the ground. We couldn't hire enough state police, number one, for this to turn out the way that you would like it, even if you were trying to punitively enforce good practice. And yes, you're right. Our state police have their hands full with speed limits and seat belts and devices in the hands and all the other safety concerns that we are completely dependent upon their service. So that's kind of taking them off focus. And by the way, working with our locals where it occurs, as Dr. Box has said many times over, a lot of times, we see good practices at school. That's not where it's happening. Or if it is at a football game, folks are now locally understanding that and they're changing their practices. But it has to be enforced, whether it's on the factory floor or at the school, and that's locally. And by the way, it's not a philosophical, by the way. When I look around at other attempts at this, when it comes from maybe a national or a state fine approach, it just hasn't bent the numbers down. Dr. Buck just said there's only a handful of states where these numbers aren't going. So that's not, it doesn't give me it's not a revenue generator for me. It's an effectiveness argument to me. What's going to be most effective to bring, to slow the spread and to bring the rate down in terms of encouraging people to wear these. And I applaud locals who have the capacity at the local level. I'm not suggesting people are going to go into homes, into family homes locally, but at businesses where locals are now starting to say, look, we just can't continue to practice this kind of behavior that leads to these kind of results, that leads to this kind of hospitalization rate in our community. So it's an effectiveness hang up with me.
Brock Turner, WFIU.
Good afternoon, Brock.
Good afternoon, Governor. Just a quick question for you, and then I will have a follow-up for Dr. Box. I know that you've said in the past that you have not attributed this steep rise in COVID numbers that we're seeing to the move to stage 5. But if not to that, what do you attribute this rise to? I know we're seeing it in other states, but Indiana's rise has been similar. What do you attribute that to?
Well, I would attribute it as you kind of answered your question for me, and that is this is happening. I don't want to say it's cyclical, but it does ebb and flow around the country. Certainly around the Midwest. Stage 5 is simply the stage that we're in right now under this public health emergency. What I attribute it to, and to try to bring it down, is a massive buy-in by the public, one by one, to do the 3 or 4 things that we know work, like are working in our schools, like are working in our businesses, to keep them open. And so that's, our obviously I'm not going to shut the borders down. I'm not going to shut commerce down and think that will eliminate the spread or the positivity rate. That would be the absolute. We are not in the same position that we were in the spring, and we have the capacity to care right now. When we start to lose that capacity to care, then we're going to have to become more and more restrictive. And that's why we're begging with every single Hoosier out there to do their part and not act like by not doing so, it has no effect on not the stage, but the rate.
Thank you.
I think
yes, thank you.
Yep.
And then question for Dr. Box. In terms of the spread that we're seeing in long-term care facilities, that's been equated to spread within the communities that those facilities are in. Is that something that you would echo and agree with? And then if so, what tools do we have in our toolbox to be able to turn that back down again, other than mask wearing? Because, I don't know that a lot of Hoosiers are sort of abiding by that.
Yeah.
I think it's an excellent question. I do believe that it is very difficult when you have high levels of community spread for this virus, and our workers and individuals that go in and out of those facilities are out in the community. We know that more of them are going to get infected. Some of those workers, many of them, may be in the age range where they have a much higher incidence of not being symptomatic. So, maybe our 20 to 30-year-olds could be as high as 60 to 80% of them aren't symptomatic, when we know the general population 40 to 45% aren't. And it's just that need to make sure that we are protecting actually the residents that live there to the very best of our ability from this being brought into them. So that's why we're working with the National Guard to try to take certain burdens off of the long-term care facility workers, like entering the frequent testing that they have to do, like the need to be able to screen people at the front door or screen staff when they come in, and then repetitively disinfecting certain surfaces that are touched over and over again. But I think also providing everyone with N95 equivalent masks so that we know if by chance somebody is asymptomatic and they just did their Bionux Now card and it showed up negative, even though they might be positive, because we know there's a pretty high false negative on that, at least we're doing our best in changing our gloves, changing our gowns, and wearing an equivalent of an N95 to try to prevent that. And I know that General Lyles is here, so he may have a comment on that too.
That's thanks to technology. General Lyles, could you just, with that first wave of personnel going into our long-term care centers, talk a little bit about the feedback that you've already received and the experience and how it has been productive?
Yes, sir. Thank you. General Lyles, the Adjutant General, Indiana National Guard. So we were able to get our soldiers and airmen into 149 facilities on Monday of this week. And our first few days in the facilities have been very productive. The feedback that we are getting is that our soldiers and airmen are augmenting the staffs, and they're helping the staffs with adherence to CDC guidelines for wearing their PPE. They're helping at screening at the front door. They're taking temperatures and really enabling the staff to do their job. So I think it's been a benefit so far, and it's been what we call in the Army a combat multiplier that'll help us reduce the spread of the virus inside the facilities.
And then Dr. Box mentioned this, General, but wave 1 and then 2 and 3, you're again planning to have that done before the end of the month.
That's correct. We have over 490 soldiers and airmen at Camp Atterbury right now, starting the in-processing and the equipping of the PPE and the scrubs, as well as undergoing the training by ProBerry to set the conditions for them to be in the facilities on Monday. That's wave 2 that'll put us in over 250 facilities. And then by the 16th of November, we expect to be in all 534 facilities.
I've never met more force multipliers in my life.
It's amazing, isn't it?
It's good to have you on board.
Nikki Kelly, the Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Good afternoon. I have two quick questions. The first is about contact tracing. According to several statistics, we have about 10,000 fewer than we should. And I'm just wondering at what point contact tracing, given the high numbers of cases, basically stops working.
Yep.
And then the second question is, you have said we're taking a surgical approach to this, but we have 72 counties in the top 2 tiers of spread. And is it more like we're doing triage and just dousing fires?
You want me to start with the first one?
I'll take the loaded question second. Okay.
So, Nikki, Indiana isn't the only state experiencing this high growth in the number of cases. As I said, we've had over a 200% increase in our number of positive cases since mid-September. And to my knowledge, there is no other state that's giving up contact tracing and that work to try to identify individuals who have been in close contact with somebody who is positive. That being said, we still believe that the centralized contact tracing where we send out that initial text, we're reaching 75% of people for that callback interview. Unfortunately, that interview takes a long time, and so when you multiply the number of cases by the number of close contacts there, that has really added up. So as I mentioned, we are decreasing the length of the interview that we're doing and actually prioritizing the questions to make sure that we get the most important ones included there. We're also added, 300 additional contact tracers in the month of October, and we'll be adding 300 more in the month of November. And we've made a commitment in working with our local health departments that if we don't hear back from these individuals, if they don't engage with us and tell us who their close contacts are, we send that within 48 hours to our local health departments because many of them are very engaged and doing an excellent job of this across the state.
And I would agree with you, Nikki, actually. Obviously, triage, I want surgeons doing triage. But what I mean surgically is we look at every single county, all 92 counties, and you're right to point out the rates in all of our counties, but one this week is blue. But we don't generalize in saying, where is the outbreak occurring in County A or County B or County L. We look at how to course correct in each and every county. So it's not like we're taking our eye off 90 or 88 counties who are orange, or 70 or 60, whatever it is for that day or that week, but we're looking very locally, and then we're taking surgical approaches to course correcting in each county. And it could be at a Department of Corrections, it could be at a long-term care facility, it could be at a high school football game after party, it could be at so it's just A to Z, and it changes by the hour or by the day according to what's happening on the ground. And so that's why we look at this county by county. And when you look at the 3 red, they're not close to one another. And so that just further illustrates our point that when you get red, we gotta make more. We're not only giving you more recommendations, drastic recommendations, but you're talking to every health district at least twice a week.
Absolutely.
Directly.
And then individually, some
But
hospital
then-
systems and healthcare.
Right. So it's an ongoing. I guess I'm not trying to wordsmith this, Nikki, but I guess I would say we will continue to take a surgical and very localized approach according to the rate of a local community.
Rob Burgess with the Wabash Plain Dealer.
Good afternoon, Rob.
Good afternoon, Governor. Good to be with you again. After
You as
last
well.
night, I'm not sure if I've had too much coffee or not enough.
Not enough is always the answer.
Yeah. In Wabash County, you won a strong majority of votes last night, but at the same time, it was by about 10% fewer than President Trump did, and Donald Rainwater actually received a higher share of the vote than Woody Myers did, in Wabash County anyway. Yesterday, I interviewed several local voters who said they split their tickets, voting Republican for president and Libertarian for governor, and they told me they were upset about masks and shutdowns specifically. In fact, in Wabash County, I've said that part already. Now that you've won another 4 years, what is your message to this block of otherwise Republican voters who have bristled at these steps you've taken?
I don't think the frustration or the impatience with getting through COVID-19 is partisan whatsoever. I think there are folks across the whole political spectrum who, quite frankly, would just wish this away or hope that it wasn't so. And unfortunately, or fortunately for us, we just don't make decisions based on politics. And so what I would say is, we're making decisions based on the common good and trying to get us through this as safely and swiftly as possible. And it has zero to do with political capital or election results with me. And others may have chosen to govern that way. That's why I think it was a good thing that we had a lot of options out there, quite frankly. And I'm, again, appreciative of everyone, and it could be a record turnout. I'm not talking about my support, but a record turnout overall. I appreciate everyone registering their opinion. And if it comes down to a single issue, so be it. If it comes down to the total package, I'm good with that too.
Sherry with the Indianapolis Star.
Afternoon, Sherry.
Good afternoon. I have 2 questions. One is a quick question for Dr. Box, which is just, do you envision the state schools dashboard becoming mandatory at any point, given that so many schools currently aren't reporting? And the second question, I don't know if it would be for Dr. Box or Governor Holcomb, trying to put myself in the shoes of a healthcare worker who, as you say, they're exhausted, they're working really hard. And I'm not a healthcare worker, obviously, but I think it might be hard to look around and feel like other states are putting in restrictions, whether or not that's making a difference in their numbers. And, I'm working my fingers to the bone, and that hospitalizations number just keeps coming up, and we're talking about surge planning. So what do you say to a healthcare worker who's kind of like, I'm trying to keep people alive here, and I see those voices out there, and it's hard when I feel like the bars are open.
Mm-hmm.
So, first of all, the school dashboard, I would say about that It's not my desire to have to mandate something like that. The schools have had so much on their plate, and they are working so hard with us and partnering so well with the contact tracing and testing within their schools. They're now piloting a couple of the schools with local health departments using the BioNX Now cards in the schools. And again, we're 98% open to some in-person instruction as opposed to a lot of states. And really, I think the data that's coming out and the information that's coming out really supports the importance of having schools open for a lot of reasons that have to do with not just education, as we've talked about before, and that the spread is not really occurring because someone's coming and sitting in a classroom and getting instruction or learning. So, is it possible it could come to that point? Yes, but I'm not at that point yet, and that's not where we're headed. I'll speak first about the healthcare worker thing, and then, Governor, you probably have something you want to say. But, the most important thing I think we can say to our healthcare workers is we see you and we hear you. And if we want to respect our healthcare workers and our hospital system so that every Hoosier in our state, no matter what their health problem is, can get the best care ever, then what we'll do is we'll social distance and we'll wear our masks and we'll do careful hand hygiene. We'll work with our contact tracers. We'll stay home when we're sick and we'll get tested if we want to respect our healthcare workers. And that's exactly what I would tell them, that we are working to try to get additional staffing for them, talking with our hospital systems about ways to, manipulate and move different individuals into different positions. Again, trying to work our Bowen Center Workforce Reserve numbers to see if we can increase that. But I think the most important thing is we do see you and we do hear you.
Yeah, I would just add, and we'll continue to work with you. I mean, we knew this before COVID-19, that it takes a very special individual who follows a calling into helping others and seeks to improve another person's quality of life at times before their own. And COVID-19 has moved that into the forefront like never before, at least for the last 100 years. And the way that our healthcare network has adapted under intense pressure coming from multiple directions, we'd be lost without their stamina and their commitment. And that's obviously going to be reflected in every decision that we make. And it also needs to be reflected not just by our local leaders, but also we, the people, in our daily lives.
Meredith with WLFI.
Good afternoon, Meredith.
Good afternoon, Governor. So I have a couple of questions. So our health department has been getting several calls about businesses who haven't been abiding by mask mandates and social distancing. They say that they go to the business, they tell them to do it, but there's nothing they can do to really reprimand them. So I guess my question is, if there's not going to be any type of, mandate to force these businesses to abide by those rules, what would your advice be to local health departments? And then on top of that, this is the second time that Fountain County has been red. Is there any specific spread that is leading to this, or why does Fountain County continue to be an issue?
You want to take Fountain?
Yes. So I've had the opportunity to talk with Dr. Sharma and some of the county commissioners in Fountain and Warren County area. And I can say that one of the underlying issues there is a significant resistance to social distancing, wearing masks, and just kind of this concept that, the belief system that the COVID pandemic, the importance of it was actually going to get better once the election was over. So I've had that voiced to me several times. And what I would say is that, Dr. Sharma has kind of been there standing with some people supporting him, actually calling out what the important things are to do and the issues that need to be addressed. Again, it takes a buy-in from everybody in the community to work together, whether that's the hospital system, the elected officials, the public health individuals. And I would say that, I have found that partnering with the Department of Homeland Security Director Cox, who works with fire marshals in the particular counties, has been very successful at going in and emphasizing to these businesses the importance of following the mask mandate and social distancing, educating on the importance of that, and potential repercussions that could occur if they do not.
Yeah, that definitely is working, and I would, not to repeat what you just said, but we're here to help with locals, but local health departments are empowered. In fact, there are local health departments that are not just seeking, but implementing some enforcement measures on the ground, and usually it happens kind of after the fact when folks start to see things kind of slipping in or moving in the wrong direction and slipping away. But local health departments are empowered on these enforcement measures, and we are not just willing, but we're able, it's in part why we're here, to assist local communities. And Director Cox, Steve Cox, can be in Covington tomorrow, or you name it around the state of Indiana. Sorry to fill up his dance card, but that's underscores, Meredith, the point how this is going to work is that we do work together on the ground from the state and local and federal, our federal partners who are assisting us as well.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.